fever, dysuria. I don't think there's an STD. I'm trying to think history that will guide my physical here. An uncomplicated UTI.
Maybe go over the red flags.
Okay. So I would ask any blood in your urine?
No.
Any fever? No. Have you ever had a sexually transmitted disease? Have you had a new current partner that you think you might have a sexually transmitted disease?
Okay.
Could you be pregnant?
No.
Do you have a personal history of cancer?
No.
Any surgical history to your kidneys, your bladder, or any surgical history at all? Appendix removed, anything that could cause adhesions are the things I'm thinking of. Any incontinence, like where you lose your urine? No. And then I'd want to know how many babies you've had. None. Fever, night sweats, weight loss? No. So probably.
So what would you be thinking, like asking those last three?
All cancer. Fever, nights is way low. Cancer.
Cancer, okay.
Yeah. But yeah, I doubt you'd have bladder cancer. That's really low. So probably STD is a red flag. Bleeding or just hematuria. And then surgery to the site, trauma, no history of pilot or kidney infection, kidney diseases.
Would you ask about like discharge or anything like that?
Vaginal discharge?
Yeah.
You totally could, yes. That would be in a good review of systems. So any vaginal discharge, any itching, any odor, nothing like that. Yes.
Her face wrinkles when she says any odor.
Supposed to be non-biased. Just very like
Children, would it be better to ask have you ever been pregnant?
I want to know how, if she's pushed out 7 babies, her bladder's going to be falling. So then we're looking at cystocele versus maybe a UTI. So that's, I guess I should ask how many children have you delivered? Because that's your risk for that versus if she's had 3 C-sections, less chance. The vaginal deliveries that's why I asked it that way.
So then would you do a vaginal exam?
Only if she's positive for those.
Okay.
Because yeast and bacterial vaginosis mimic a UTI so much. So yes, if there was those things, you'd have to do both.
Okay.
You'd have to do both. And then sometimes your urine gets contaminated with the discharge, and so it looks like there's a UTI, but you just treat for UTI and you get the culture back and it's negative and it's really vaginal. They cross over quite a bit, particularly women in their 40s when they start hitting their perimenopause. The pH changes of the vagina and you get so much crossover. It's so hard to tease out what it really is, so you kind of just treat both, truth be told. That's where history taking and assessment sometimes is really hard and you don't know exactly what you have, so you treat the best way you can until you get your full results. So red flag, I'd be looking for pylo, STD, cancer, or adhesions, cystocele. Does that cover all the red flags, do you suppose? Okay, if I felt she was dehydrated, I'd probably just start by, just doing a quick look at her eyes to make sure, in her mouth, her mucous membranes, and that looks fine. Do a quick trigger. I don't know if you've been holding fluid or fluids down. I'm just gonna listen to your heart real quick. The bell and diaphragm. So go in order. Hold on, you don't have to say these out loud. I'm just saying them to you. Herbs. Husband. And then I would say, do you mind if I get into your breast? Skin. One of our actors on the day is female with large breasts, so just so you know. Some of you will have a man and some of you will have, and then with the diaphragm. We'll have to do the same thing with the bell, sorry. Husband, and the same thing, mitral. Then I'm just going to listen to your lungs, so we do the big breath in and out. You can just fake it. 1, 1, 2, 2, 3, 3, 4, 4, 5, 6. learn the ABCs. In and out, 2, 2, 3, 3, 4, 4, 5, 6. Under her clothes, 5, 6. Okay. So then, can you just lay down for me? Just check your belly. Any abdominal pain? Yes. A little bit of abdominal pain. I'm just gonna poke around a little bit. I'm inspecting. No masses or.
Can I ask a quick question?
Yes, of
In,
course.
when you have the model and you said,
Yes.
you know, you're gonna have her, you're gonna do skin to skin, so you're gonna
Yes.
have the
They're
drip,
gown.
the gown down, but she's gonna have like a sports bra or
Yes.
something, and then just ask her to lift
Yes.
it. Okay.
Yes, and there's the ones I have coming. I've been doing it for years, so they totally expect it, and nobody's shy.
Okay.
They know what they're feeling. So I'm just gonna listen for your vowel sounds here. If she's young and whatnot, I wouldn't necessarily do vascular because I'm not really worried about that. Any pain? Particularly, I'm gonna focus right here above the bladder. Pain? Yes. Oh yeah. Okay. All right. And then just because I'm so used to it, I would just do a quick. Make sure there's no other structures going on here. Good. Okay. Go ahead and sit up for me. I'm just gonna do a quick test here. Yeah. No pain. No. Is it itchy? Nope. Okay. That concludes my exam. Pretty short and sweet. Here's your UA results. So later on when you learn to treat, if it's a UTI case, you'll get the results, positive glucosides, positive nitrate, and then you have to say, I'm going to give you a 3-day course of Cipro. So later on you have to actually get the result and do a plan in the room on the spot.